Hello everyone, it's me, Nurse Cess, and today I will be talking about glaucoma and cataracts. Glaucoma and cataracts are both eye disorders that can cause vision loss and affect the health of your eye. Although they have some similar symptoms and share some risk factors, they have different causes, treatments, and outcomes. So what is glaucoma? Glaucoma is the leading cause of blindness in humans, affecting 2% of the population. It can occur at any age, but is more common in older adults aging 60 years old and above. Glaucoma is the result of damage to the optic nerve. As this nerve gradually deteriorates, blind spots develop in your visual field. This nerve damage is usually related to increased pressure in the eye. Elevated eye pressure is due to a buildup of a fluid called aqueous humor that flows throughout the inside of your eye. This internal fluid normally drains out through a tissue called the trabecular meshwork at the angle where the iris and cornea meet. When fluid is overproduced or the drainage system doesn't work properly, the fluid can't flow out at its normal rate, and eye pressure increases. Glaucoma tends to run in families. In some people, scientists have identified genes related to high eye pressure and optic nerve damage. Glaucoma is commonly classified as open angle and closed angle. The vast majority of glaucoma cases are open angle, also called wide-angle glaucoma. The pressure builds slowly and loss of vision is gradual. The most common form of glaucoma is the primary angle glaucoma. This is characterized by an abnormal increase in the intraocular pressure that occurs without the obstruction at the iridocorneal angle, hence the name open-angle glaucoma. Around 10% trusted source of cases are closed angle, where the blockage happens suddenly. Symptoms are swift and severe. Closed-angle glaucoma is a dangerous health condition that requires immediate medical attention. So what are the symptoms of glaucoma? Glaucoma may not present any symptoms at first, especially if it builds slowly. The first symptom you may notice is some loss of your peripheral vision. This means you may not see things well around the outside of your field of vision. Closed-angle glaucoma is more likely to present sudden symptoms, including intense eye pain. Your eye may feel firm to the touch, and it may appear red. You may also feel nauseated. With closed-angle glaucoma, your vision may be blurry, and you may see halos of light glowing around everything. It's important to get medical care as soon as possible if you have symptoms of closed-angle glaucoma. In general, people over the age of 60 are at a higher risk for glaucoma. People with African American or Latino heritage are more likely to have open-angle glaucoma. Women and people of Southeast Asian or Alaska Native heritage are at increased risk for closed-angle glaucoma. People who have an immediate family member with glaucoma are more likely to develop the condition. Diagnostic methods for open-angle glaucoma include applanation tonometry, ophthalmoscopic visualization of the optic nerve, and central field testing, while side or shadow illumination, or by a technique called gonioscopy, is for angle closure glaucoma. Measurement of intraocular pressures provides a means of assessing glaucoma risk. Because the condition is usually asymptomatic, people at risk for open-angle glaucoma should have a regular direct ophthalmic examinations on both eyes. Periodic stereoscopic assessment of the optic disc is strongly recommended for at-risk people. The elevation of intraocular pressure with open-angle glaucoma is usually treated pharmacologically. In cases where it fails, surgery is another option. Most of glaucoma drugs are applied topically. Another eye condition is cataracts. A cataract is a lens opacity that interferes with the transmission of light to the retina. It has been estimated that 18 million people in the world are visually disabled because of cataracts. Cataracts are the most common cause of age-related visual loss in the world. They are found in approximately 50% of those between 65 and 74 years of age and in 70% of those older than 75 years. Cataracts take some time to develop. You might not notice any symptoms when they first form, but eventually you'll probably experience some of these symptoms: blurred vision, double vision, poor night vision, extra sensitivity to light, pale or faded colors, and frequent changes to your eyewear prescription. The types of symptoms you have can depend on the location of the cataract on your lens. Some people are born with cataracts because of an infection in the uterus, and some people develop cataracts when they are children or even at birth. This is called congenital cataract and is very rare. Cataracts can also form after your eye has been injured or traumatized, or as a result of eye surgery. But the most common cause of cataracts is the natural changes in your eyes as you get older. It is also called senile cataract. Some other factors can also increase your risk of developing cataracts, including diabetes, obesity, smoking, high blood pressure, long-term steroid use, excessive alcohol use, and excessive sun exposure. Diagnosis of cataract is based on ophthalmoscopic examination and the degree of visual impairment on the Snellen vision test. Cataracts can also be detected with a simple dilation test during a routine eye exam. If your cataracts are small, you may be able to change your prescription to deal with changes to your vision. Surgery is the only treatment correcting cataract-related vision loss. Some of the greatest advances in cataract surgery has been the development of phacoemulsification and intraocular implants. There are steps you can take to help reduce your risk for getting cataracts. For instance, you can protect your eyes from the sun by wearing sunglasses. Stop smoking if you're currently a smoker. Eat foods that contain antioxidants that your eyes need. Reduce alcohol consumption, and take care of your overall health by getting regular eye exams and following your treatment plan if you have a condition such as diabetes. What is the main difference between glaucoma and cataracts? The primary difference between these two eye conditions is that they have different causes. Glaucoma is caused by a buildup of fluid inside your eye. Cataracts are caused by an accumulation of broken down proteins inside your eye. The outcome of these two conditions also differ. Cataract surgery can often restore good vision, but if you lose some of your eyesight from glaucoma, your vision loss is likely permanent. Are they connected in any way? You can have glaucoma and cataracts at the same time. In fact, sometimes one can lead to the other. Sometimes a cataract becomes so large that it blocks your eye's natural drainage system. Doctors may be able to remove the cataract through surgery, reopening the blocked drain and reducing pressure on the optic nerve. It is also very common for cataracts to form after glaucoma surgery. Some researchers recommend that you wait 1 to 2 years after certain glaucoma surgeries to have surgery on a cataract. The delay can help ensure that your eye is healthy and stable before you have cataracts removed. Is one more serious than the other? Well, both conditions are serious. Early detection is the key to preserving your vision and maintaining the health of your eyes. Cataract surgery is a common procedure, and it usually results in a successful outcome for most people. Because your vision can often be restored after surgery, cataracts usually don't lead to permanent vision loss. Glaucoma treatments focus on reducing the fluid buildup in your eye. So far, researchers haven't found a way to regenerate optic nerve fibers that may have been damaged by glaucoma. If you lose some of your vision because of glaucoma, it's likely to be permanent. When to see a doctor? It's a good idea to see an eye doctor every year for regular exams and screenings for glaucoma and cataracts. See your healthcare provider right away if you notice changes in your vision. Don't feel that you have to wait until your next checkup. Sudden onset glaucoma is a serious health problem. It is important to seek medical attention immediately if you notice any of these symptoms: severe eye pain, nausea or vomiting, eye redness, and blurry vision. Conclusion: glaucoma and cataracts can both lead to vision loss if they are not diagnosed and treated early. Both conditions can cause blurry vision as well as other symptoms. It is important to have regular eye exams to ensure that glaucoma or cataracts are detected early enough to keep your eyes healthy and your vision clear, especially as you get older.